Good afternoon, everybody. Welcome to the Foster Parent Information Session being co-hosted today by the BC Federation of Foster Parents Association and the Ministry of Children and Family Development. My name is Corey Heavener, and I am an Assistant Deputy Minister as well as the Provincial Director of Child Welfare, the Ministry of Children and Family Development. I'd like to begin today by acknowledging the traditional territory of the Lekwungen-speaking people, where we are today doing our presentation. And I'd also like to acknowledge all of the traditional territories and the Métis communities where you are participating at today as well. On behalf of the BCFFPA and the Ministry, we'd like to welcome you to today's information session and thank you for making the time to be here. Given how we are set up today, we unfortunately weren't all able to be here in person, but this session is being co-hosted. It will last about an hour and is being recorded, so it will be available to you after today. We wanted to begin by thanking each of you for all you're doing to care for children and youth in care every day, and in particular during this unprecedented time that we find ourselves in. Foster parents play such a critical role in the lives of children and youth in care, and we have so much gratitude and respect for how you are navigating the challenges and the stresses that the pandemic presents. We hope you and your families are keeping well. Ongoing connections between children and youth in care and their families is essential. And during the past few months, your role in supporting virtual connections has been so appreciated. As you know, on March 26, in-person visitation between children and youth in care and their families was suspended, and visits have been occurring virtually since that time, with exceptions as well. This remains in effect today. The suspension of in-person visitation is currently being reviewed with a view to developing an approach to reinstate in-person visits in the near future. The approach needs to be aligned with the provincial health officer's guidance, recommendations, and principles to ensure everyone's health and safety. I know you will have lots of questions about resuming in-person visitation, and we want to make sure you have the information and answers that you need. The purpose of today's information session is to answer any of the health-related questions you may have regarding COVID-19 in an effort as we work towards resuming in-person visitation. As you know, we've requested your questions in advance, and there's lots of great questions that we have received. The questions today that aren't health related, we will ensure that you have answers in the coming days. Today, Dr. Bain Smith, Deputy Provincial Health Officer, is joining us to provide an update on the current pandemic situation and to answer the questions that you've provided. It is my pleasure to introduce and welcome Dr. Bain Smith, and I'd like to extend my gratitude for her ongoing leadership, the ongoing leadership of the Provincial Health Office, and their commitment to children and families. So I'm going to turn it over to Danielle, and I will thank her for being here now. Gets a little tricky to actually come back at the end because we have to make sure that everything is cleaned and that we're physically distanced. So we'll just need a couple seconds.
Okay. Good afternoon, everybody. Bon après-midi. My name is Danielle Bain-Smith, and I'm Echo Dene from Fort Nelson First Nation, and I'm French-Canadian and Métis from the Red River Valley. And as Corey mentioned, I'm very, very grateful to be working as the Deputy Provincial Health Officer for Indigenous Health under our wonderful, fearless leader, Dr. Bonnie Henry. And I'm really pleased to be joining you today from the offices at MCFD on the territories of Lekwungen peoples, of the Songhees and Esquimalt nations. I'm very, very grateful to be an uninvited visitor on their territories. Thank you. As Corey mentioned her gratitude, I also want to express my thanks to everybody on the line for tuning in and for all the wonderful work that you've been doing over the last few months. This has been, as everybody knows, an unprecedented time, and it's been really incredible to watch people come together with one heart and one mind to try and uphold the population health principles to keep ourselves safe and keep the people around us safe. And it's been remarkable to see how that action has resulted in some really tremendous changes in the curve of the epidemic here in BC. I also want to acknowledge that many people have been called upon to continue providing essential services. And I know that many of you work with some of the children in our province that face some of the greatest challenges and vulnerabilities. And I'm so grateful to you to continue providing those safe homes and spaces for those children and youth. Even though I think of that 7 p.m. cheering on of frontline workers, healthcare workers, and in my mind, that includes all of you and everybody who continues to do the things that need to get done despite being in a COVID-19 world. So I was hoping to cover a couple of things on the call today. And thank you so much to everybody who took the time to send in questions. I've looked through them all, and they really speak to me about how nuanced and complex your sector is, the work that you do, and how there's so many different variables to consider. So I'm hoping that through the presentation today, what I will cover is a little bit about thinking about where we've been, sharing with you what we've learned specifically around the epidemiology and science of COVID-19 and children, and then talk about next steps and where we're hoping to go. And so I'm hoping that that will provide a little bit of clarity around some of your questions. A lot of your questions really raise some excellent, very specific situation type questions. And so I will try and address those a little bit more directly at the end of the presentation, and we'll just go from there. So, in terms of what's happened here in BC, just thinking about our chronology, things really took off in BC around mid March. Prior to that, we had a few imported cases from some of the hotspots of COVID-19 outside of Canada, and we were doing an excellent job, I think, actually, of identifying and containing those cases. And in mid March, all of a sudden, it became really clear to us how um, advanced the disease had spread in the states south of the border, Washington State in particular. And as soon as Dr. Henry became aware of that, she spoke to government, and together they took this coordinated action and instituted a range of population health measures that were quite extreme and drastic, as you all know. And I think we all shared that same fear and concern mid March into late March as we held our breaths, because at that point, nobody really knew how much seeding had occurred and where the peak of our wave would happen. British Columbians really stood up and, as I say, took these messages to heart. And together, we watched as we had a peak in our curve and then gradually bended the curve and now have flattened it. And that is really a testament to how seriously people took these messages, and in some cases actually even went above and beyond what Dr. Henry and Minister Dix were recommending. One thing I want to flag for people, because I did see it in the list of questions, was a concern about people who maybe weren't taking physical distancing as seriously, or for a range of reasons were unable to kind of take that to the nth degree in the ways that others were. And I just want to flag for people that in spite of that, physical distancing is really a population health measure. And so even though not every single British Columbian did it in the same way, together we were still able to get into that flat part of the curve. So I just wanted to flag that for people as a bit of a reassurance, because I know that can be scary when we see people who aren't doing what we think they should be doing. But really, the data is speaking on behalf of everybody's good efforts, and that certainly in this case, it was good enough. So, um, since the start of the pandemic, BC has had three goals in its response. The first has been to protect those who are most vulnerable. And we've seen in other jurisdictions and here in BC that the people who are at the greatest risk of severe COVID 19 are people who are elderly, particularly over the age of 65, those with chronic health conditions, heart, lung, weakened immune system, um, and certainly, if you put those two things together, then that really does increase the risk of severe COVID 19 even further. The second goal has been to protect our healthcare system. So, to ensure that we have the necessary beds, equipment, and staff at our hospitals so that over the period of pandemic, should any of us require hospital level care for any reason, that it be available to us. And so, as I say, if we think back to that, that time in March, we were all sitting with bated breath, thinking, had we done enough? Had we done it soon enough? And that was as we were watching places like Italy and New York become overrun. And I, like everybody else, was feeling that anxiety. Thankfully, our curve peaked and our healthcare system had a lot of capacity. And so I think we did a good job in that regard, all of us together. The third goal has been from the outset to minimize the impacts of the population health measures. We know that physical distancing, encouraging people to stay at home in their small groups, come with a number of impacts, health impacts, social impacts, economic impacts. And so we've been aware of that from the outset, and we've been watching the data very closely to find the right time to start turning the dial. And you've heard that many times, that this is not about flipping a switch and going back to where we were prior to COVID 19, but really taking a very measured, Western science informed approach to gradually bringing things back online, increasing our activities, and increasing our social connection somewhat. And so, Jesse, if I could get the next slide, please. Oh, perfect. So now I'm hoping that you're looking at a slide that says outcomes by age and gender. And this is a really important slide for a number of different reasons. It really helps to illustrate for us who is at risk of severe COVID 19 and who is not. So there's three really important messages that the science is showing us in regards to children and COVID 19. The first is that children are much less likely to get COVID 19 than adults. And so, as you can see on this slide, this is from data up until the end of April. And I think now into May, the more up-to-date data has the number of cases in people under the age of 20 is around 60 to 65. Which is a very, very small number of our total cases. Here and around the world, kids represent about 1 to 5% of cases of COVID 19. When we think through the potential trajectory of people that get COVID 19, either people are going to get well at home, a smaller number, 20% or so, will require hospitalization. So maybe I'll really emphasize that point. 80% of people who do get COVID 19 are going to have a mild to moderate illness course that can be managed at home. So for 80% of us, it will be very similar to a cold or a flu. 20% of people will require hospitalization, and 5% or 15, well, 20% in the hospital, 15% will be in the hospital but not in critical care, and 5% of people that get COVID-19 will require intensive care. When we think about that trajectory for kids, the numbers are much, much less. So, of those 60 or so children or people under the age of 20 who have gotten COVID 19 or tested positive for COVID 19 in BC, only 3 have been hospitalized. None have been in the critical care unit. And luckily, we've had no deaths in people under the age of 20 in BC. This is not to say that there aren't exceptions. Certainly there are, but it is very, very rare that children get severe COVID 19. Mostly, kids are less likely to get COVID 19 than adults. If they do, their illness course tends to be far more mild. And perhaps as a result of them having that milder illness course, they don't seem to be very good transmitters of COVID 19. So they don't seem to spread COVID 19, which is different than other respiratory illnesses like influenza, for example, where kids are in that situation amplifiers. That doesn't appear to be the case with COVID 19. So, in the vast majority of cases, children have gotten COVID 19 from an infected adult in their household. We don't have any documented evidence of children giving COVID 19 to adults, so being the quote unquote index case. And we also don't have any evidence of children bringing COVID 19 home from school or daycare, for example. What I really want to flag for folks on the call is that we have some incredible leadership in the province, both in Dr. Henry in public health and also in the provincial government. And we are very dialed into the science, the emerging science around COVID 19. There's a team of people that are scouring the literature on a daily basis. Dr. Henry is in daily contact with other public health leaders from across the country, rather. Um, and so, in the case you may have seen in the media of the outbreaks in a daycare facility in Montreal, so Dr. Henry has been in direct contact with those public health officials to get a better understanding of the circumstances of that outbreak. How did that transmission occur? And so, we are constantly gathering information and learning, and then using that to inform our next steps and our policies and guidelines. So I just want people to really be aware and kind of be able to have a look behind the curtain in terms of how decisions are being made and what types of information are being used. So I feel very lucky and very confident that we are working on the best available science at this time. One other thing, I do like to comment to stories in the media because that's, a lot of us have that as a source of information, and sometimes the context isn't always fully there. So, some of you may have seen reports about complications of COVID 19 in kids, specifically Kawasaki's disease, which is an autoimmune blood vessel condition. So, I just want to flag for you that that is a condition that is triggered by a number of different viruses. And so we would expect and have seen that COVID 19 is a virus that can trigger Kawasaki in some kids. There have been a small number of cases. I was speaking to Dr. Henry about this yesterday. I believe there's been about 15 reports in the US, 20 reports in the UK. And so this continues to be a very rare complication, serious, but rare potential complication of COVID 19. And so I just wanted to provide that little bit of context as well. And then if we go to the next slide, this is just another image that sort of places our experience and trajectory in BC against other jurisdictions. So again, I feel like this just really speaks to how seriously people in British Columbia have taken these measures and these recommendations. And also, as Dr. Henry has pointed out, part of it is luck. So we were lucky in terms of the way that we got seated and the structures that we had in place prior to the pandemic. And so I think this is a reflection of all those different pieces. And then if we move to the next image, oh, perfect. So this speaks to some of the modeling that's been done. So Dynamic modeling is a fancy type of statistical analysis, and there's a really amazing team of, and no disparaging intent meant, of like super nerds that work at BCCDC that put together this amazing data. I have so much admiration and respect for them. And so, what they were able to do was use dynamic modeling to try and provide an estimate of how much social distancing we have achieved in BC. And so, looking at our actual trajectory and looking at how many people have been in critical care, they were able to estimate that British Columbians have reduced their social contacts to about 30% of what we normally would have had prior to COVID 19. What they do then is do some dynamic modeling of the future. And it's really important to remember that all models are wrong, but some are useful. So these are not crystal balls. These do not predict what will happen. There are so many different variables that could influence what happens in BC. But what this seems to suggest is that we have a little bit of wiggle room when it comes to social distancing. So if you're looking at those bars or those lines on the bottom, if you look at that orange line, what that is telling us is that it looks as though we could increase our social contacts to about 60% of what we were doing prior to COVID 19 and still stay in a relatively flat part of the curve. What it also shows us is the danger of that sort of light switch approach. So, if we were just to go back to the way that we were doing things prior to COVID 19, which would be the light pink line and the darker pink line, that we would get ourselves very quickly back into that steep part of the curve, and we would be endangering or jeopardizing our first two goals of protecting those who are most vulnerable, the elderly, those with chronic health conditions, and protecting our healthcare system. So if we move on to the next part of considering this, considering the restart plan, when the premier made his announcement last week, and all of the documentation that's gone up on the website since then, it really speaks to four phases of this restart or going forward. So, acknowledging that phase one is the current state. So, that's really acknowledging the many different sectors and service providers and people that have continued to provide services through the pandemic, so who have found ways to adapt or decrease slightly their services, but continuing to fill those basic needs. Phase two is where we're about to go. And so that's what we've been having a lot of talk about. And it's about restoring a number of different sectors and services. So within health services, thinking about elective surgeries, dentistry, in person counseling, and again, thinking back to those three goals that we have, I've got two hands up, six goals. I'll keep it with three. Um, this is really about balancing those first two, protecting those who are vulnerable and our healthcare system, and balancing that against the burden of the population health measures. So, phase two is really about trying to bring things online that will maintain the integrity of those first two goals, but ease some of the burdens and negative impacts. As I mentioned yesterday on a call, bullet number 4 of hair salons and barbers in the list is of particular importance to many of us. And so we're anxious to see that come back online. And so, really, as we move into this next phase, we're really thinking through how can we bring things back online, but also do it in a way that is safer, as safe as we can make it, to minimize the spread of COVID 19. We're going to be watching very carefully phase two. And if transmission rates remain low or stable or decline, then we'll think about phase three, June to September. So that's looking at things like K to 12, post secondary, hotels and resorts, and a few other sectors. But it's really important to emphasize that um, I think that how we've gotten into such a good place in BC is that we have been evidence informed, data informed, and really being guided by the numbers as opposed to many other potential pressures. And so we're going to continue to do that. So as people move forward into phase two, we're going to be watching things very closely. And we're only going to make that next step if it seems like it's something that is appropriate for that period of time. So we'll go into an image now that's going to help us think about how do we move forward in this way, um, in the safest way possible. So Dr. Henry spoke to this inverted pyramid last Monday, and it's the hierarchy of controls for COVID-19. Um, if I could get it tattooed on my forehead, I would, I think, because it's so critically important to this new normal and living with COVID-19. And the more we can embrace all of these elements and interventions and the hierarchy that they live in, the more that we'll be able to resume more and more activities that we enjoyed prior to COVID-19. So this inverted pyramid goes from the interventions that are most effective at preventing the spread of COVID 19 down to interventions that are less effective. So, right at the top is physical distancing. So, keeping ourselves at 2 meters or two adult arm lengths away from people when we're outside of our home is one of the most effective ways to prevent the spread of COVID 19. Other really critical pieces in there include staying away from others when we're sick. So, this is going to require a cultural and paradigm shift for many of us who soldier on or power through when we're feeling a little under the weather. In this new normal of living with COVID 19, in the absence of a vaccine and the absence of significant community level immunity, that simply cannot continue. We recognize with the outbreaks at the poultry processing plants on the lower mainland that this is a gap, a significant gap for a segment of the population who do not have the safety net or the financial privilege to be able to not go to work when they're not feeling well. So, this is an issue that's been flagged for the Premier. I understand from Dr. Henry that he's taken it very much to heart, and I've heard from a number of different ministers, Minister Darcy, Minister Simpson, that this is an issue that's being discussed at Cabinet, and acknowledge that we need to find a way as a province to support people and ensure that they are able to do the things that we need them to do. So physical distancing, absolutely critical. Below physical distancing are engineering controls. So that includes things like the plexiglass barriers that we see in grocery stores and the pharmacy, and other physical barriers that, in the absence of that distance, are things that can prevent infected droplets from going from one person to another. Below that, we have administrative controls. So, those are things like policies and guidelines that help to minimize or stretch out the number of people that are in contact at one time. So, that could include things like work from home options, that could include staggering. Times for meal times in different settings. It will include things like smaller groups of children and youth that get together. So ensuring that class sizes are kept small. Maybe students. This is not. This is me brainstorming. So don't take this as 100% how things will go. But perhaps alternating days that students would come in for in classroom instruction. Essentially, all of those different policies and guidelines that help to promote physical distancing. And then at the bottom of this inverted pyramid is personal protective equipment. And so you've likely thought about this, you've likely heard about this. It's a topic that I absolutely never want to have to speak to, unfortunately, due to the global shortage that we have in terms of supply. Masks, gowns, gloves are things that are in high demand around the globe as a result of this being a global pandemic. We have some incredible work happening here in BC. We have a provincial PPE supply working group that's working in close collaboration with the federal government to ensure a constant supply into the province. That said, despite these really amazing efforts and creative solutions of looking to all different manner of acquiring PPE, we still only have a trickle of a supply coming in. And so we do not have a large stockpile or buffer. And right now, all of our PPE is directed back into the healthcare system in order to hold up that second really important goal of keeping our healthcare system functional and running. So all of that said, it's really heartening to know that PPE use in the community really does fall below all of these other interventions. So, even in the absence of PPE, we have all of these other interventions we can look to that, in fact, are far more effective at preventing the spread of COVID 19. That said, PPE can provide or play a bit of a role in terms of potentially keeping infected droplets in, so keeping somebody's infected droplets in, if they're going to need to be, for some reason, in close contact with somebody else. Close contact is defined as being closer than those 2 meters or 2 adult arm lengths for more than 15 minutes. So it's really a function of the distance and then also the time. Um, so that's basically, as I say, what I want to reinforce on this slide is just that physical distancing continues to be the most effective way to prevent the spread of COVID 19 when we're outside of the home. The next slide or image that I want to share with you, because I think it's also so critically important. I don't know where, I guess I would get that tattooed. Maybe on both cheeks might work. I don't have that much facial real estate to get these key messages out. But this is a 2x2 matrix that helps us think through those two critical variables that really determine the risk of spreading COVID 19. And it has to do with the number of contacts that we're having. So, the number of people in one space at a given time, and also the contact intensity. So, how close are those people and how long are they going to be in that close proximity for? So, this I think is a tremendous tool. And thinking and reflecting on all of these excellent questions that you've put forward that are very nuanced and complex, this is a tool that we can use, all of us collectively or in our own situations, to think through that particular scenario or activity or service and really think about, okay, what is the number of contacts that are coming together at this particular time? And then what's the contact intensity? Like, how close are people going to be? And if we answer those two questions and find that we're in that darker blue, high risk, high risk scenario, then we can go back to that inverted pyramid and think through, okay, what are the ways that we can institute administrative controls, engineering controls that are going to help promote physical distancing? So, one of the questions that was asked had to do with supervised visits in sort of a communal space. And so the suggestion was, are there going to be, policies or practices that restrict the number of people coming into that space at the same time, and increased cleaning and disinfection of the toys, for example, that might be in that space. So that person is ahead of the curve, totally embracing all of these principles in terms of how to move forward into this next phase, is exactly to do that, is to think through, okay, how can we ensure that we've got smaller groups of people getting together in spaces that accommodate more physical distancing, and trying to limit the closeness of those contacts. That said, I also want to take a moment to comment on, because obviously, such an important area of conversation is the idea of foster families and then biological families and in-person visitation, and what's the risk there and how do we manage that. So I just want to flag for people that probably the highest risk part of those encounters is going to be between adults as opposed to between children and adults. So again, kids are more likely. So let's start from the top. Kids are unlikely to get COVID 19. So not very many kids are going to get COVID 19. If they do get it, they're most likely going to get it from a sick adult. So that's administrative control number one. So we don't do visits when somebody is having symptoms or is sick. So already right there, you've reduced some of the risk. If that child does get COVID 19, it's unlikely that they're going to pass it on to an adult. They just don't seem to be great spreaders of the disease. So, keeping adults apart to a certain extent is perhaps more important than also keeping the kids apart. So, I took that message to heart, and trying to imagine what it would be like to have a toddler with their biological dad, and trying to keep those two individuals physically separated. That's just, it's heartbreaking to think about that, really. And so I think we need to reframe that this is about balancing risks, and to really think through, if that individual, that father, is not overtly symptomatic, the risk of him spreading COVID 19 is pretty low. We know that it does happen. There is some asymptomatic transmission, but it's not what's driving the epidemic. And then the risk that that child is going to get COVID 19 is lower. And then the risk that that child is going to pass it back into their foster family is lower yet. So I want to be really clear that it's not no risk. So there is no risk zone in this new COVID-19 normal. But I think it is so important that we do think about the risk accurately, because it does have impacts on children and families and create stress. And so we really need to mitigate that. But I think that our sense of risk has been inflated somewhat by watching what's happened outside of our borders, from our own messaging early on, because we really didn't know how bad things were going to get. So we needed to get people to pay attention and be very, very vigilant. But now we're at a place where we're in the flat part of the curve. We have a better handle on where things are at. We have a better understanding of the science of COVID 19 in children. And we really do know that 80% of people who get COVID 19 are going to have a mild to moderate disease course. And so when we think about the people in the province who have lost their lives to COVID 19, so just over 130 individuals now, um, all but a handful of those have been in people over the age of 70. So the median age for people that have died from COVID 19 is 85 years old. So when I think of children and families, of course, there are going to be exceptions of foster caregivers who do fall into that older age category, who do have chronic health conditions. So those are areas that will need to be a little bit more nuanced in thinking that through. But for the majority of us, the risk is there, but it's perhaps not as scary as we maybe thought earlier in the epidemic. So just trying to keep that in mind. And then Jesse, if you don't mind moving forward to the next slide. Thank you. Oh, perfect. I was ahead of myself. I know that you, people that are on the call, aren't seeing my bulleted notes, but I just want you to know that I nailed it. I was right on. So public health recommendations. So prevention measures and mitigation strategies involving children and youth must be commensurate with the risk. So I won't belabor that any further. When it comes to adolescents, we're recommending that they should physically distance themselves where possible when outside the family unit or household. They're adolescents, right? And we know that teenagers haven't been, well, I don't want to use a broad stroke, but there are some teenagers who have not been fully upholding physical distancing, and yet we still got into that lower part of the curve. So I just want to again flag that for people that that these are population health level measures, and so we just have to keep that in mind, that this is about most of us doing what we can most of the time, but we're not going to be perfect. For younger children, again, the idea of physical distancing is a bit less practical. So I think the messaging that you're going to hear as the documents come out around school and childcare settings is really going to be about reinforcing that message of keeping your hands to yourself, and just trying to focus on that. And the Ministry of Education has been working really, really hard in collaboration with MCFD, in collaboration with Dr. Trevor Cornell from our office, to think about a couple of different things. So, one is how to create that in class space today for students who are children of essential workers and students who are facing vulnerabilities or challenges, or their families are facing vulnerabilities and challenges. And really, school is an integral piece of their well being. So that is an expectation that those spaces be available for students today. And there's been quite a bit of work happening to scale that up even as we speak. And so, as schools move forward, there's going to be more guidance around, again, being more explicit about what are some of the engineering controls that can be put in place and some of the administrative controls to help ensure that kids are assisted in keeping more physical distance. So, staggering recess times, smaller class sizes, propping doors open, lots of hand hygiene stations and cues, screening again, reminders that if you're sick, you don't come to school. All of those different pieces will come out in the documents in the next few days and weeks. And so those are, yes, those are looking at the speaking notes again. I nailed it, got that one also. And then moving forward to the next piece. Oh, yes, perfect. So BC CDC, so the BC Center on Disease Control, is really our source of truth on anything health related that has to do with COVID-19. So it has all of the information that I've been sharing with you today and much, much more. So I would direct you there as an excellent site to get more information. I'd also love to flag for you that there was a survey that was launched called BC Speak, survey on the population's experience, actions, and knowledge. And this is a piece of work that's come out of the Unintended Consequences Working Group, which is a group that, as the name would suggest, is trying to better understand the broad impacts of COVID-19 and population health measures on all British Columbians. So we really do want to get as representative a sample as possible. Since Dr. Henry announced the survey earlier in the week, as of yesterday at 8 p.m., there had been 35,000 responses. I understand that there still were not very many responses from the North. There are opportunities to self identify as First Nations, Inuit, Metis, as well as opportunities to share race demographics. This has been a huge gap. in terms of COVID-19 data across the country. In the states where that collecting that data is a routine, there have been, lots of examples of disparity based on race and ethnicity. And so this has been flagged, and Dr. Henry has been advocating at the national level in order to change the way that we collect the COVID-19 data. We're not there yet, but in this survey, there is definitely an opportunity for us to illuminate and see how different groups are impacted differently. Because, of course, we didn't come into this pandemic on equal footing, and we know that different groups are being affected differently. The survey is only for residents of British Columbia 18 plus. But does have some questions about other people living in the household. And so I would encourage you to have a look there. And I don't think that it explicitly discusses Indigenous data governance principles, but there is absolutely governance in place that ensures that any First Nations or Métis data will be analyzed and shared and reported in alignment with Indigenous data governance principles. And then the other website that I would flag for you is WorkSafe BC. So as we move into phase two and bringing sectors back online and expanding services from those phase one sectors, WorkSafe BC is stepping into a leadership role in terms of providing guidance and specific protocols to all of those sectors on how to resume activities in a way that's as safe as possible for employees from an occupational health and safety lens. So it's important to note that that is going to be an important source of lots of wonderful information in the days to come. They are working in very close collaboration with BC CDC and folks from the Ministry of Health in Public Health, because those are the folks that are thinking of the health of the population and the public, not just the employees. So bringing those two perspectives together is really important. And what's going to come from that are, as I say, specific guidance, protocols, an overarching document that's going to review 6 steps to ensuring a safe workplace. And so that's a place that I would encourage people to go and look. They're working day and night right now to develop those documents, and they should be posted by Friday, is my understanding. And then the last point, I think, Jesse, if you go, oh yes, is just to flag the many different collaborations. So there are so many people that are working together right now to try and align and coordinate and interpret and implement these high level population health principles. So Ministry of Education, Ministry of Child and Family Development, Ministry of Health, school districts, public health at the regional levels, WorkSafe BC. There are a lot of really brilliant minds and dedicated folks that are coming together and trying to get the best information out in the quickest way possible. We appreciate your patience and your understanding that this is unprecedented, uncharted territory. And so everybody's doing their best. And again, I love being able to look back at our curve to say, we've come this far and we don't want to move too quickly and lose the gains that we've achieved together. And so I just really want to raise my hands to all the people that are working so hard on entering into this next phase in a good way. And again, to everybody on the call for the services that you've been providing. So with that, that kind of concludes the opening remarks that I wanted to share. Again, I was not paying very close attention to the time. I haven't gone over yet. There were a lot of excellent questions, and I think that a lot of this information has provided context for some of those questions. But what I will do, if my computer lets me, it is just go back to the top and see if there's anything that I can add to specific questions. So so there were at least two or three questions about children in care who might have chronic health conditions, or caregivers who were over the age of 60 with or without other chronic health conditions, and what would the considerations be for that moving forward. So I can't speak on behalf of Corey or MCFD in terms of how the high level principles are going to be interpreted and implemented here. That said, I can say that we've been working together very closely and really acknowledge that this is not a one size fits all type of endeavor. So Dr. Henry from the outset has been reluctant to use, for example, public health orders, and has used those only in a last case resort, because those types of orders are blunt instruments that don't allow for, that more nuanced application. The deputy minister from the Ministry of Social Development and Poverty Reduction, David Galbraith, on a call just earlier this week, I think characterized it really aptly when he said, phase two is not going to be fair. So we're not all going to enjoy the same relaxation of measures in the same time frame or the same way, based on our own personal bubbles and our own personal health risks, based on our geography, where we live. There's so many different variables that are going to impact how we choose to move forward. So I think absolutely that though the situations that have been described in the questions do need to be thought through quite carefully. And then what I would urge people to do is not get stuck in sort of black and white type thinking, but really think through that 2 by 2 table, and then think through those hierarchy of controls in terms of if what you're looking at is a situation or a scenario or a visitation that you think is going to be higher risk, what are the things that can be done to facilitate that connection, but do it in a way that is going to be safer and reduce that risk of transmission. And I'm so grateful that what we've learned so far about kids and COVID-19 can really help reassure us that the risk to kids and the risk from kids remains quite low. And so we really need to be balancing that and thinking about that when it comes to reconnecting kids with their families. Um, I'm just looking through again. Oh, yeah. So the province has said we're able to slowly expand our social circles after May long weekend. There was this reference to increasing your bubble by 2 to 6 people. There's no science behind that number. It was used as an example that really got picked up by a lot of different people as that's the number. There's nothing scientifically specific about that number. It really was just Dr. Henry trying to illustrate the point that that's a number at which, once you think about all the other bubbles that those 2 to 6 people are connected to, that you could actually be expanding your bubble quite significantly rather quickly. Again, it's not just about the number of contacts, it's about the contact intensity. So we really want to think through what are the ways that we can expand our bubbles, but do it in a way that minimizes the intensity. So, for example, my dad lives here in Victoria. He and my daughters are very, very close. It's been really hard on all of us to not be able to get together in the ways that we normally would have. This past weekend, it was so beautiful that we made a plan to meet in a big open green space. My dad had his picnic blanket, we had our picnic blanket, and we were able to have that social connection in a way that was safe, that was very low risk to everybody involved. And so those are the types of considerations that I hope people will be able to apply as they start grappling with these decisions about what does this mean for our particular situation. And I do want to acknowledge, I know there's amazing foster families out there who have a number of different children living with them. I've got a very well, I consider her a sister, and I know that her family, has had dozens of children that have come through their home. And so I can really imagine, the stress and the complexity of thinking through visitation and all of those pieces. And wow, those bubbles just all of a sudden really expanded. And so I'm not saying that these will be easy calls to make. I don't think that they will be. But I do think there are a few tools and a few ways for us to think through collectively how we can facilitate connection and still keep things relatively low risk. The biggest piece, I'm going to keep going back. Now I've got to figure out where to get all these tattoos. But the other piece would be just staying away from others when you're feeling sick. When we're thinking about visitation and those connections with bubbles, that is so critically important that when people are not feeling well, that they stay away from others and get tested. So this is a change in the messaging from when we were in that steep part of the curve. There were a couple things happening at the end of March. We didn't have enough testing capacity, or we had less testing capacity. And in outbreak management, when you're in that steep part of the curve, your goal is not to catch every single test. It's just not feasible. Where we are now, however, we've ramped up our testing capacity and we've got a low number of cases right now. So we do want to do everything possible to catch every possible case. So, one, stay away from others. Two, get tested. Those are two really important messages. I know we're getting closer to the end of our time together. So I'm just going to scroll through these great questions to see if there's anything else that we haven't really touched on yet. Um, and they're all very similar around this idea of in-person visits and how do we manage that and what is the risk. I think we've covered those quite a bit. Again, quite a number of questions around, if the biological family, for a lot of different reasons, are challenged to kind of keep up with the public health recommendations. What does that mean? Again, I would point to where we are in the curve right now. We're in a flatter part of the curve, even in spite of the fact that there are some people in BC who haven't been able to kind of fully embrace social distancing. A very specific question about do the virus droplets adhere to exhaled cigarette smoke and create additional hazards? Quick answer, no. So it's just the virus is spread by infected droplets. It doesn't hang in the air. The maximum distance it can travel is 2 meters, which is why we talk about that distancing. Just having a quick look through again. I think we've really, for the most part, covered the themes and topics. I'm happy to come back at another time if there's burning questions that I didn't cover today. Thank you again from the bottom of my heart for everything that you're doing. I'm so grateful. My traditional name, I don't know if I shared this last time, is Azanazo. It's crying all the time. So I really feel things very deeply, and I do feel so grateful to everything that you're doing. And yeah, I wish you all the best as we move into this new phase together. And thank you so much. Masicho.